Welcome to the Scoliosis Specialist Podcast, where we discuss science-based treatment for scoliosis. Hello and welcome. Welcome to our Scoliosis Podcast. Today we have a special guest all the way in from Dallas, Texas. Actually practices in Southlake, Texas. Flew in all the way from Texas today, this morning, to do a podcast with us. And so we're just going to have a nice discussion today about scoliosis and try to answer as many questions as we can and fill the public in on maybe certain treatments that are best for them or their children. So I wanted to welcome Pediatric Orthopedic Surgeon from Dallas, Texas, Dr. David Brown. David, welcome.
Thank you for having me.
Thanks for coming. I really appreciate it. So, as we talked about doing a podcast for a long time, and I was like, do you think you would come? Because you've supported us in what we've done and what we do. You've supported this we just talked about it, right, for about 3 years now. Right? And we talked that we've now been working together for approximately 3 years. So how did you first hear about SpineCor?
Through other patients. So I've been in pediatric orthopedics now for about 3 years, and my initial exposure to SpineCor period was when I was a fellow 20 years ago. They were doing a research study on SpineCor and comparing it to rigid bracing, and rigid bracing was the gold standard, and so they were well aware of all the limitations of rigid bracing, but didn't have another good option. And so when SpineCor came out, the spine surgeon I was working with was very interested in it, was interested in doing a head-to-head study with rigid braces and comparing it. And so they were doing this study on SpineCor. And unfortunately, about 6 months into it, they stopped the study. The initial results were just that it wasn't as good as a rigid brace. And I didn't really have enough exposure in my fellowship to SpineCor to really understand any of the principles behind it, what it was supposed to be doing, how it was supposed to be achieving that. So I was very familiar with the problems that I had with getting compliance with rigid braces. There's, even in the kids that wore them like they were supposed to, there are times where you just have a type of scoliosis that's going to be driving and not work, and so some of those kids end up needing surgery. But the biggest thing that I kept coming back to is kids not wanting to wear the brace because they didn't like the way it felt. They felt claustrophobic in it, or they didn't like wearing it at school where people could see this rigid brace, and then they couldn't do anything in their rigid brace. And so I had a patient probably 10 years ago who had heard about SpineCor out of Atlanta, coming to Dallas every so often and fitting kids with the SpineCor brace. And at the time, I didn't even realize it was SpineCor. I was just aware that there was someone who was coming in, fitting with a brace, and then they would come back and check them every so often. And so my initial thought was, oh yeah, whoever's flying in is some charlatan that's selling them snake oil. And so my only thing I wanted them to be sure was to keep following up with me to get regular x-rays when they weren't in the brace to make sure their scoliosis wasn't progressing. And
Can I go back a second?
Sure.
So I wanted to go back because you had mentioned that they were doing this study, and then because you had told me, I was introduced to SpineCor 15 years ago.
Yep.
And then they said it didn't work.
Right.
And then you said to me, you were a little upset it didn't work because in your mind, when seeing it, and the theory behind it, and the way it would work three-dimensionally for a three-dimensional problem,
right,
you said to me, it didn't make sense that it didn't work.
Yeah, I may have misled you on what I thought about that.
Okay.
At the time, since working with SpineCor over the last 3 years with you, I've gotten to really understand much better the principles behind it. And really probably the first time I met you, really understood the principles of SpineCor much better than I do now, much better than I did then.
Right.
But just the fact, even if it didn't have rotational component, even if it didn't sort of help train the muscles to hold that posture, why a flexible brace that's correcting scoliosis wouldn't work as well as a rigid brace didn't make sense to me.
Right.
And so from my standpoint, if you had better compliance because it was a more comfortable brace than a rigid brace and you could wear it during activity, those things made me think that likely it would work better than a rigid brace. So when the study stopped and they said, oh yeah, it just didn't work. Again, I didn't know spine, when you look at a SpineCor brace, it doesn't look like anything that's tugging really hard on the spine. It's a soft brace that has a little bit of elastic in it. And so my thought was probably, oh, it's just too flimsy. It doesn't do enough. It's not rigid enough. It doesn't pull hard enough.
So after working with us,
yes,
because you've been with us,
yes,
you actually invited us to come into your office,
right? Because I had patients that found you guys, and even though I was skeptical, I'm open-minded, and so as I continued to follow them, I had 2 patients that I actually saw gain correction in their curves, and that's occasionally we'll have someone who has back pain, and you get an X-ray, and they have a little bit of scoliosis, and then their back pain goes away, and their scoliosis goes away, but typical scoliosis, when we use rigid braces, we never tell people they're going to get correction. Our number one goal is to try to prevent it from getting worse. And so when I actually saw correction, then that's even better than not getting worse. Right. And the first time I thought, oh, it was probably just going to get better anyway, but I'd followed that patient for a couple of years, and their curve was getting worse with a rigid brace. And so for them to switch to something else and then to see it get better, at first I just sort of tucked it away. Okay. When I had my second patient that was using SpineCor, and I think at the time they were just holding it. It wasn't a lot better. It was kind of that bouncing 2 or 3 degrees one way or the other, but it was staying the same. And so I thought, okay, I've got some patients that I think might really be able to benefit. Kids that weren't going to wear a rigid brace, they weren't going to be compliant with it. And so when we called you guys, and the first time I talked to you on the phone, I realized, okay, these guys understand scoliosis. They're not bracing people. One of the hard parts for me is if I call an orthotist who's making a brace and I see a kid back and the brace isn't made exactly right, as I talk to them, they know about bracing, but they don't really understand scoliosis. And so they don't understand the cause of scoliosis. They don't understand the 3-dimensional aspects of it. And so all I can really tell an orthotist is push harder here and less over here and try to get a brace that gets more correction. And when I first called you guys over the phone, it was very clear that you understood scoliosis at a different level than what I was used to talking to bracing people about. Okay. And so we had a couple of patients that I was interested in fitting with SpineCor and seeing how they did with SpineCor. And that first trip you came down, got to watch you fit some patients with it and talk to them about the concepts. You and I talked separately for hours just over about the concepts of SpineCor. And kind of one of the biggest impressions you made on me that very first time was talking about experience of SpineCor, even for people who are starting out with SpineCor, that there's a big learning curve to it. It's not something anyone can just go take a SpineCor course and start doing.
So can we go back then 15
Yes.
years ago when
Yes.
they stopped?
That's where I was going.
Okay, so
Yeah.
they stopped that study and said it didn't work. Do you know now, after spending 3 years with us,
Yes.
because Dr. Brown does come into the rooms, all his patients, he's watching carefully, he's following up with them, even though if he's referred them to us, he's still, the main doctor for that patient and is following through with follow-up. So oftentimes you'll sit in the rooms with us and you'll listen to everything, you'll watch everything, and you just be okaying everything and making sure that, we're doing the best thing for your patient. Have you figured out, has something come, have you had any conclusion of why SpineCor didn't work in that study 15 years ago?
Yes, and it's because it's why it works now, and it's because of you guys, right? You guys understand scoliosis. You understand the principles of what you're trying to treat, and the orthotists there are orthotists around the country who do SpineCor, But their concept of taking a curve and pushing on the edge of the curve and trying to straighten it out, that's not what SpineCor does.
No.
And I feel fairly confident that the orthotists that were applying the brace for our research study, they were just the same orthotists that we always used for rigid bracing. So I really believe they brought them in and just said, oh, there's a curve going this way, we'll pull this band this direction, there's a curve over here, and we'll pull that curve this direction, without really understanding, is it
It's just
starting
that
in
three-point pressure system, right?
Yeah.
And yeah,
and scoliosis is too complicated to be treating in a two-plane
right.
idea. And so, and that was the impression that you made on me the very first time, seeing patients and watching you try to correct rotation and bend. And then the thing that you said that really made an impression was that even when you were first in practice, you know, you'd get a little bit of correction with something, and you thought, oh, if I got a little bit of correction, we'll go harder. But harder, actually, sometimes the body fought against it, and then you didn't get as good a correction. And so,
Exactly.
how many years have you been doing the SpineCor now?
I think it's been about 22 years.
Yeah.
Right.
And so, and I've been in practice for 20 years, right?
Right.
It's amazing how many things I'm learning today in the last 2 or 3 years. And like principles from SpineCor, I've learned a ton about scoliosis by seeing the principles in action and seeing kids do well.
Yeah. So, and you know, I always say when Dr. Lisa and I come in and we're practicing, and you're in there, and then we go to dinner and we talk about different cases, and I think we learn a lot from each other, and we can bounce off, right? Because you have, you know, orthopedic surgeons over here, which mainly do surgery, but not alternative to surgery, not alternative treatments. You use a brace. If you use a brace, do you make them the brace, or you just send them somewhere?
Send them to an orthopedist.
You send them somewhere. So it's not even you that's making the brace. And so I always said that's a downfall. The tough thing that SpineCor has in the world, because they're a phenomenal brace, right?
Yeah.
We use them all. We use the hard braces, yep. Right? And we'll talk about that in a little bit. And we use SpineCor on everybody. We use hard braces on just a few people, but in combination. But it's the learning curve. It's the SpineCor learning curve. It's just not easy to learn. And so I remember using it for 5 years and still seeing patients come back and back and back and going, why did I do that 4 years ago? And why did I do this? And how am I going to fix that? And how am I going to do this? It just took so long to learn and understand to get to that point where you can master something, right? And so that's the tough part. I don't think just anybody can put SpineCor on a patient.
Yeah. The truth is, any brace, right? Even the orthotist, there's a learning curve.
Right.
But SpineCor, the genius of the brace is that if someone really understands how to use it, it can work amazingly well.
Right.
The problem, and you and I have shared a patient that we experienced, someone who did a SpineCor and did it poorly, right?
Right.
And so that's the problem. It's the person putting the brace on is the most important part about SpineCor.
Let's talk about that patient. We don't have to mention names, but
yeah.
let's talk about that patient. So you had referred a patient to us that lost our number, looked somebody else up, and was fitted by somebody in Texas.
Correct.
And they were fitted, and then they came back to you, and then you were following through with them, but they weren't getting better, were they?
They were actually getting worse.
They're getting worse.
Yeah.
Okay.
And it just so happened one day that they were in the office for. I always see those patients back, tell them to be out of the brace for a day and check their spine to see. I want to see, is the curve getting worse? Is it staying the same? Is it getting better?
Okay.
And so I was seeing her back, and it was getting worse. And you guys just happened to be in town that day and were there, and so asked you to pop in there. And sure enough, you know, when you went in, you looked at the brace and said,
well, I looked at the x-ray and I looked at the brace configuration, the way it was configured. And it wasn't only the tensions on the bands that play a huge role, but it's the actual configuration. So there's a lot to know when doing this, but I looked at the x-rays and I looked at the configuration. I said, this is going to make her worse.
Yeah.
Right? And then I asked
And
you
it
what
did.
you want me to do. And it did, right?
Right.
It was making her lumbar curve worse for many reasons. And so, it was your patient, so I need to ask you what you wanted to do. And we talked to the parents. And we didn't want to throw anyone under the bus. I didn't want to throw any doctor under the bus. I'm sure he didn't do anything on purpose. It's just he didn't know.
Right.
And that's the biggest problem we have is they're not experts. And some people do it as a side business, and you can't.
Right.
Right. So we talked to the parents and just said, I just felt, hey, we might be able to fit this a better way.
Right.
Would you want us to do that? And they said yes. The girl was thrilled. We fixed the lumbar curve at that point, got her better, and now I think she's out of the brace.
She is out of brace and maintaining her alignment. So
That's phenomenal. So we love hearing results like that. You also mentioned something the other day that we were in town, and you asked your staff. We've been there 3 years with you. How many patients have you had that have been coming in for the last 3 years that have had to go to surgery?
none.
So you have zero.
Yeah. And some of as well as I do, you've had patients that went on and needed surgery.
Happens all the time, sure.
Sometimes
Sure.
scoliosis is there's a drive there that despite bracing, it's going to go on and need surgery eventually. And there are times where I'd be happy if SpineCor just let them get 2 or 3 years of growth, so that we weren't fusing their spine when their
Right.
spine is this big. At least let them get to a more mature age before they need their surgery. And so some of it's luck that I just haven't had that pathologic patient come in with something that's really driving the curve, and even with SpineCor is going to get worse.
Right.
But I haven't had any patients in the last 3 years that are using SpineCor that have needed surgery.
Now, we've used SpineCor during the day for all the neuromuscular reeducation. If they're young enough and have a lot of growth, we've also been able to make them a nighttime overcorrective brace as well. And we haven't, but anybody that's in the scoliosis world,
Right.
and any doctor in the scoliosis world will have kids that have to go for surgery.
Sure.
They can't function as an adult. And this was one of my podcasts earlier that I had an opinion on certain things, and that was, in the orthopedic world, it's usually a number, meaning an aggressive surgeon may do surgery at 40 degrees. A less aggressive will wait till 50 degrees. And I've never really had a number myself, as long as I thought they could maybe function as an adult. Are they balanced? Are they balanced, in all the planes? Right. They might have larger curves that will have no problems as an adult, as compared to even maybe a smaller curve that's really unbalanced, right? And that may need surgery. So it's never really been a number for me as much as it is it affecting the heart? Is it affecting the lung? Is it going to affect them as an adult? And can they function as an adult? And when I can determine that when we do an exam and x-rays and fit them with a brace and see what we can do at that point. But we all have patients that are going for surgery.
Sure.
And we do recommend surgery in certain cases, right? I remember, I'll never forget, I sent a boy to Shriners in Tampa. He was a patient here, and he had literally a 38-degree curve, but it was up in the base of the neck, and it was really looking like the Hunchback of Notre Dame, right? It looked really bad, and he was 10 years old. He had a lot of growth left, and I said, if that gets a lot worse,
It's going to be hard to fix later.
man, it's going to be a problem. And that's just not something that it's not in an area we can actually get to it, right? And he had been to a lot of other doctors that do 2-week intensive programs. No, you don't need surgery, you never need surgery. It's always just the canned answer.
Right.
Never do surgery, never do surgery, never do surgery. Which I feel could be dangerous at times. for him at that time, 38 degrees, I've never referred a surgical case at 38 degrees, but I felt go.
Yeah. At least get it.
Have a
Evaluated,
relationship with
yeah.
a surgeon now. Get that relationship. Figure out what they want to say. It was funny because the Shriners guy kind of threw me under the bus. He goes, 38 degrees. We're not doing surgery on that. He doesn't know what he's talking about. And I was kind of like, I sent this guy to you, and you're saying I don't know what to talk about. Right. Long story short, they came back to me for a follow-up. They still used SpineCor, and they couldn't get surgery. They came back for a follow-up, and it was 80. And I said, well, maybe you need to go back to that surgeon and see what he says now. So they did. And the surgeon said, yeah, you need surgery now, but it's too big for me to do. You need to go to, I think it was Dr. Linke in St. Louis.
Yeah.
Well, he had to move to St. Louis, had to move in, live there for 3 months so they could traction him, right? Because by the time he got there, they couldn't take him for 6 months. It was 130 degrees. Okay. So now he's in traction. Now, remember, I referred at 38 degrees,
yeah.
right? I knew that was going to go. And because of the experience, I've had so much experience with it. I know what we can get to. I know what we can't get to. And I know it's going to be a problem for this child. He's a good-looking kid. He could get something easily corrected at that time. Anyway, he was in traction, halos for 3 months, and then he still looks horrible.
Right.
But we're always going to have a patient. You and I will, in your practice, we're going to have somebody. But what are our ultimate goals? Our ultimate goals: stop progression, avoid surgery. We want to create strength and stability so they can function as an adult. And I always say lastly, so the difference between probably me and every other alternative doctor, lastly, I'll get as much correction as I can.
All right.
Well, I see a lot of people starting with, oh no, we're going to get correction, we're going to get correction. It's a dangerous game.
But again, the reason you and I have a relationship is because on the first time I met you, I realized that what was important to you were your relationships with patients, and you cared that you helped them have the best clinical outcome that they could have. It wasn't about how many office visits can I get out of this patient? How many, can I sell a brace? It was not a business to you. It was that you cared about scoliosis, and that you developed an expertise that you didn't want to waste, right? It's
right.
When you know a curve is going to get worse, sitting on it doesn't help you, right? And you want to, the experience that you gain, the things that you want to use and help people with.
Right.
And that came through the very first time I met you. And not wanting to promise correction, because not everybody's going to get correction. Not promising that they're not going to need surgery, because some people will need surgery. But I believe SpineCor is the best bracing option out there right now. I believe that I get better compliance with my patients, and so there's not a better option for me to use, except that So it's the best option for me to use.
I get it. And listen, when I started with scoliosis, rigid bracing's been out for years and years and years, and I just never used it because alone, it just didn't get the results that I wanted, and compliance was a big issue as well. There's a lot of other reasons kids don't want to wear hard braces. But we don't always have the backing from orthopedic surgeons, right? Because is it because they think it doesn't work, or is it they really don't know the alternative side of it? Or, I always said, if you're going to do something alternative to surgery, go to someone that specializes in alternatives to surgery. We have these guys out there, and surgeons like yourself, because when they need surgery, we need someone that specializes in that surgery, right? That's very good at what they're doing. And so we feel we're the best at this. If my child needs surgery and is going to you, I don't want you studying daily on my brace.
Right.
I want you to know the best thing to do to get them in safe and off that operating table with a great result in safely.
Right.
Right. And that's the biggest concern of most parents and people getting.
And I don't want 5 or 10 years worth of patients that didn't do quite as well as they would have if I sent them to you to brace them, right? And that, getting to your point of, why don't all surgeons use SpineCor?
Right.
And it comes down to it's just the way we train, right? I was at a very big, large pediatric orthopedic facility in San Diego that did tons and tons of research. If there's any place that SpineCor had a chance, it was there. And they trained enough pediatric orthopedic surgeons that if they started using it and it kind of caught on, they would, all their residents, all their fellows that came through would learn about SpineCor, and they would all be using them in practice. And it'd be one of the tools that they had in their bag, along with rigid bracing, along with Schroff method, or other things that people are doing these days. And so, but the reality is we just don't, because there aren't academic centers using SpineCor right now in the United States
Properly.
Properly, right? They have an orthotist, and orthotists do great with braces, with rigid braces, but they were trained to do rigid braces. They weren't trained to do SpineCor braces.
Right.
And so, having people that'll go through the SpineCor training, then having the chance for them to have that experience, I think SpineCor could really take off and get really big in the United States. But it's going to take, you need people who can train people.
Right.
And you've got that experience. That's why I don't really want to go find someone else in Dallas or someone else in Texas to do my braces, because I know I'm going to get a better result if you're bracing them than if someone else is.
And I appreciate that. And you will. It's just, you will, because this is what we do. This is what we study. This is all we do. It's not just SpineCor, but it's scoliosis. And so I always tell people, I've been to 4 different countries, 4 different children's hospitals. We don't stop. It's what we do. We worry about our patients. I mean, we've got a great relationship in your office because we practice, we're very similar in our way of communicating in our practice, which brings me to one more question for you. The protocol in the U.S. has always been, for an orthopedic, if it's not 30, come back. I don't know what you would do, but it's mostly come back in 6 months. You might go to 3, I don't know, but come back in 6 months and let's see if it's progressed.
Right.
And starting at 30. After working with us in hearing what we say and do, and our best results are with, the smaller the curve, the better the result's going to be in the long run, right?
Sure.
Have you thought about that and on when recommending treatment?
Yeah, I was always sort of trained until it gets to be 25 degrees, that it's as likely to stay where it is as to get worse. And so there's no need to brace before 25. The idea, everything came down to a cost-benefit ratio, right? Do you pay for a lot of braces in kids that have curves that are less than 25? But the end result, all the studies that's based off of, are how likely are they to go on and need surgery? And so, the most unhappy patients I have are patients with 40-degree curves that are not well balanced, and we're telling them, it's not big enough for surgery because it's not likely to progress the rest of your life, or to progress really slowly, and so you're just going to have a 40-degree curve. So cosmetically, they hate it. And so I've always been a little bit on the side of bracing earlier than 25, particularly if I've seen them a couple of times and I see it progressing. So if I have a 10-degree curve, I'd almost never brace at this point. But if I see someone and they have a 10-degree curve, and the next time I see them they have a 15-degree curve, the next time I see them they've got a 20-degree curve, I'm not going to wait till they get to 25. I think the thing that's probably changed since I've been working with you is, even now when someone comes in with a 15-degree curve, I'll tell the family, look, the books say wait till it's 25 till you brace, but your child's young, they have a family history of scoliosis, that you get other risk factors where you just kind of know if you don't do something, it's probably going to get worse. And so I'll tell them about SpineCor and rigid bracing and the advantages and disadvantages.
Yeah.
And some of those people elect to start early, and they do they do well.
Well, so using SpineCor at
Yeah.
15 degrees,
Yeah.
a lot of times I can straighten the curve.
Right.
So this could be the big outcome, right? So
Yeah.
if I can start somebody at 15 and I wait and
Yeah.
it goes to 30, probably not getting it to 0.
Yeah.
But if I can start at 15 and get it to 0 and they can grow straight, has that changed
So
their
now you're
life?
promising correction.
No.
No, just kidding.
But if I can, right? Right? But if I can do that,
Yeah.
and we can correct that down to where it's not even diagnosed as scoliosis, what a different outcome in life.
Sure.
So my thought is this. I always said for the surgeons or doctors that are recommending when to get treatment, it was, why don't you give the parents that option? Why don't you explain it to the parents and let them make the decisions?
Yeah.
You can give them the pros and cons, but let that parent, because a lot of times what's happening is people are coming into me with 40, 50 to 60 degree curves. And I said, okay, who's your doctor? When did you start treatment? Well, I see so-and-so, and we started treatment. We found it at 15. We went back 6 months later. It was 30. And so then you want to put a brace on her. She put a brace on, but now it's 40. Like, how do you feel about that? And they're just upset that they found it at 15 and weren't recommended anything. So I said, you don't have to. I'm not asking you to sell us. I'm asking you to say, explain the pros and cons to the parents. Let the parents make the decisions. It's their child.
Yeah.
Let them make the decisions for their child.
Yep.
And the smarter decision, what do they want to do? So at that time, if they decide to hold off and wait, they don't feel gypped. Does that make sense?
It does. I'll tell you there are two pieces. One, you go back to training. We're trained to do it a certain way. And so when you get trained 25 degrees, you do a brace, 50 degrees, you do surgery, it becomes, that's just, you go into practice and that's what you do. That's why it's that way. But part of the reason it's that way is insurance companies that say, oh, you need a $6,000 brace, $7,000 brace, whatever their brace is going to be. And they say, no, we're not paying for it. So if the doctor recommends a brace at 15 degrees and the insurance company says no, and then they've got to say, well, this patient has a family history of it.
Sure.
That I've watched it go from 8 to 15, and they've got 5 more years of growth. I really want to use a rigid brace. They end up having to be on the phone, talking to the insurance company to justify it, writing letters to try to get it approved, and then sometimes it still doesn't get approved.
Yeah.
And so that only has to happen a few times where people go like, okay, the insurance companies, in their mind, the insurance companies won't pay for it until 25 degrees. And so I think a lot of us, as we're trained to believe if I recommend a brace early at a 15-degree curve, that the insurance company is not going to pay for it. And so, and I don't want to create an expense for a patient that if it may not get worse, then I was trained statistically it's as likely to not need surgery.
Right.
Again, the surgery being, that doesn't mean they're not likely to progress. It means they're not likely to need surgery. But everybody starts out at a 15. There's no one who skips from, no one all of a sudden has a 25-degree curve.
Right.
And so I agree. We should be bracing earlier. And I do, by and large now, have that discussion with people that if they want to start, go ahead and start bracing. Their chances of doing it effectively are better.
Well, yeah, and that's what I like about you too, because I've been in consults with you. I've been in the room. I've heard you as I'm walking by to one of my rooms, and I hear you talking to them. You're not forcing them to do anything. You never force them. You're giving them a recommendation. And I think it's just important to let the parents make that decision. If it's 15 and it's going to be $5,000 and the insurance isn't going to pay, that's the parents' decision of whether they want to come up with it or they want to wait until something else is there. And that's all it is. It's simple. But if we can tell them and say, hey, this is a possibility. It happens through growth. We don't know when you're going to have that massive growth spurt. And if you have that massive growth spurt and, 15 goes to 30, now we got a bigger problem.
Right.
Are you willing to take that risk? Some are.
Yep.
And I get it. Some are willing to take that risk. I don't want to do anything, right? I'm not that guy. I'm not going to be that doctor. but I am going to tell them all the pros and cons, and I still let them make the decision, right? I just give them my best recommendation. I welcome second, third, fourth, fifth opinions. I don't care.
Sure.
I will talk to any surgeon in the country about why I made my recommendation.
Right.
Right? I feel I've studied this subject enough that you as a surgeon, and doing what I do, we can have conversations about anything.
Right.
Right? And I'm learning from you. You're learning from me. And we've got a great combination. We're getting phenomenal results out of your office in Southlake, Texas. And we get phenomenal results here as well. And I just say the earlier we can get it, the better. I mean, we are ecstatic that we have the support of a pediatric orthopedic surgeon that is open-minded, right? And you weren't just open-minded. I'm just open-minded to everything, and I'm going to allow it to be happening. That's not what you meant.
There's still a lot of bad alternative treatment options for scoliosis out there.
Right.
I am willing to listen to the pros and cons of different things, and if it makes sense to me, try it.
Right.
I let those patients, if I'm going to try something new, or if a patient comes to me with an idea of something they want to try, I'm always very open-minded to letting them try whatever they're going to do, but continue to follow it like I would normally follow it.
Right.
And we've had great results with SpineCor.
So I don't mean to put you on the spot right
Sure.
now, right? But I'm going to.
All right.
Because, and it might help me, your answer, because I am licensed. I'm not licensed to do surgery. I don't do surgery. That's not what I do.
Right.
But I have a license and certifications in everything that's alternative to surgery. So I can choose to do any treatment I want in my clinic. And I have done multiple things over the last 30 years.
Sure.
I've done multiple things. And I can take those things and I can look at them and say, that didn't work.
Sure.
Boy, that was really promising. And they sell correction, and I can do this, and I'm going to add that. And then I add it, and there's a poor result. It didn't work.
Right.
So I've come down to, after all these years, to say SpineCor works the best for me. One, because it's full-time, 20 hours a day on a growing child, full-time, neuromuscular re-education. They can move. Compliance is good. Sometimes with bad curves, younger ages. I also do a nighttime overcorrective brace, which I get a phenomenal result with. But there's nothing else that's been out there that's given me that result. And if you came to me and said, hey, I really think this is going to work better, I'll do it. Do you know anything?
I don't.
Okay.
Yeah, and largely, some of that, to be fair, is I'm not a big believer in testimonials. So if someone comes, that one patient that I had that originally used SpineCor that I thought, okay, well, occasionally I used a rigid brace and I saw a curve go away, but I didn't really think it was the rigid brace that made it go away. Otherwise, why wouldn't you have lots of patients where it went away?
Right.
And so show me one or two patients who do well with a therapy. You can find testimonials for almost anything.
Sure.
But now we have 100 patients that have gone to SpineCor. Maybe not that many, but maybe 50 patients have done SpineCor over the last 3 years, and I get at least as good a result as the rigid brace, and really probably better in most of them.
And we here in the Atlanta clinic, we have thousands of patients in SpineCor. That's where we got our experience, and our experience really comes from them coming back over time and seeing what's happening and what's going on, and different flexibilities of spines. Those all play a part, as we know. But we really appreciate you flying in, coming in, and talking. I think the public will love to listen to it, love your perspective. I mean, they're always looking for a second opinion. It's almost like a second opinion. We thank you for your faith in us. I mean, you invited us into your clinic. I don't think a lot of surgeons would do that and have trust in somebody to let them see their patients.
Yeah, it's the only way I get to see it.
Right.
If I sent them to Atlanta, I would have no idea what you guys were doing.
Right, right. Well, we love working there. We love seeing the patients. We love seeing the results. It's our passion in life. I know it's your passion as well. We really are thankful that we have your backing and your confidence in what we do. And we just can't thank you enough. And we've enjoyed our friendship as well. And thanks for coming.
It's been
Appreciate
great.
it.
Thank you for having me.
For those of you that have listened to today's podcast, feel free to get more information. You can go to scoliosisfix.com. The number will flash across the screen. All the information is on our website. Feel free to call. Our assistant will ask you for a little bit of information. She'll give it to one of the doctors. One of the doctors will give you a call and give you a free consultation on the phone. If you have x-rays, we can do a full consultation on the phone. If not, you can schedule something in the office or get an x-ray locally, and we'd be happy to do a free phone consultation with you. Again, it's scoliosisfix.com.